Hello, you're welcome to my platform. I am Dr.Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about a pilonidal sinus. By definition, a pilonidal sinus is a small opening that is located on the skin between the buttocks. Just beneath this small opening is a small tunnel that ends blindly into the tissues of that area, and it usually contains hair. In order for an individual to end up with a pilonidal sinus, there can be one of the following things that can happen, or a combination of the two things. Number one is that the individual could have had an abnormality in the skin between the buttocks, and this abnormality could have been present at birth. And there is also an abnormality in the way hair grows around this abnormal area. For example, the hair is supposed to grow outwards, but for individuals of this caliber, the hair grows inwards, and so it can easily get trapped into the skin. The other way a person can end up with a pilonidal sinus is local pressure. For example, individuals that have jobs that entail sitting for a long period of time, they can end up with small openings forming in their skin. And local pressure can also cause trapping of hair within the small openings that have been formed. When hair gets trapped within the small openings, there can be a response by the body, a response called inflammation. Inflammation, by the way, is a body's way of fighting off any invading agents. For example, germs, but in this context, a hair follicle that has been trapped within the skin. This inflammation, this irritation, can cause infection to set in, and infection can be repeated. This leads to formation of pus in the area and discharging of pus through a small opening that was formed initially. The individuals that are at risk of developing pilonidal sinuses include individuals that have a family history of pilonidal sinuses. For example, if the mother had a pilonidal sinus, the daughter or the son can also have a pilonidal sinus. Individuals that have sedentary occupations, for example, bankers, truck drivers, individuals that are overweight or obese, individuals that have a hairy natal cleft, that is, if they have a lot of hair in the area between the buttocks, individuals that have sustained trauma in the area, the natal cleft, that is the area between the buttocks, and individuals that have persistent irritation of the natal cleft, the area of the body between the buttocks. The clinical presentations of the pilonidal sinuses include a small opening on the skin between the buttocks, and this can be followed by swelling, a small swelling that forms in that area. The individual will also develop some acute symptoms. For example, they will develop swelling, pain, and tenderness. That is, when they touch that area, it will be painful, and there will also be pain emanating from that area. There will also be pus formation in and around this small opening. When the affected individual does not seek surgical intervention, they are going to develop chronic symptoms. For example, they will develop pus discharge from this small opening. And what you have to know is that when this pus discharge starts occurring, the individual's pain will tremendously reduce. But this does not mean that the individual has been healed of the pilonidal sinus, because majority of the time, when the pus comes out of the sinus opening, that is that small opening, there's going to be a reduction of pressure within the sinus tract. and this can give an illusion that the condition has gone away, but the condition is going to be recurrent. It will happen again. The symptoms of pain and discharge, that is pus discharge from the small opening, are going to be recurrent, and this will go on for a long period of time. The patient, if they don't seek medical attention, they'll also continue getting recurrent infections within the sinus opening and the sinus tract. So it is very, very important that the affected individuals come to the hospital and seek surgical interventions. This recurrent inflammation or irritation in this area can also predispose the affected individuals to cancer. That is a cancer called squamous cell carcinoma. It is a form of cancer. So it is very, very important that the affected individuals come to the hospital and seek medical and surgical intervention. When it comes to the treatment of the pilonidal sinuses, the following interventions have shown to work. For individuals that just have a small opening in the affected areas, we only recommend that they should exercise good personal hygiene. For example, they should shave regularly such that we don't have any hair getting trapped in the small opening. For individuals that have acute symptoms, for example, they have pain, they have swelling, they have tenderness, that is, they feel pain when they touch the affected area, we recommend antibiotics, painkillers, and we can do a surgical procedure called incision and drainage, just in case there is pus formation in the affected areas. Incision and drainage, by the way, is a surgical procedure where in the areas that have had pus collection, we make an incision over the skin to allow drainage of pus from underneath the skin. For individuals that have chronic symptoms, we always employ wide excision plus allowing the surgical site or the operation site to heal by secondary intention. Wide excision means that we make incisions on either sides of the sinus opening and the sinus tract, and this incision also entails taking away the entire affected skin or irritated, inflamed skin together with the sinus opening and the sinus tract. And after that, we allow that operative site to heal by secondary intention. Secondary intention means that we just allow the body to take over the healing process. That is, the wound is going to heal from the bottom up. And as time goes on, the wound edges will close off by themselves. The body will take over the closure of the wound edges. We don't have to close them. This is the best strategy because the recurrence rate is minimal. And of course, if for the surgical site or the operation site, we just continue to dress until the healing has occurred. When it comes to the prevention of the pilonidal sinuses, we recommend that please exercise regular shaving such that the area between the buttocks does not have any hair. Please make sure that you avoid prolonged sitting. Please also avoid trauma to the area between the buttocks, and please lose weight. If you're obese or overweight, please lose weight because this can predispose you to this condition. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.